If you have severe narrowing of the coronary arteries, your heart's muscle cells will be starved of oxygen and nutrients. You will need to have the blood flow restored to these muscle cells, and this can be done with an operation called coronary artery bypass grafting, also known as CABG. This operation is performed under general anesthesia, which puts you to sleep. The surgeon opens your chest so that they can work on the heart. The surgeon will remove a piece of vein, usually from the leg, or a section of artery from elsewhere in your body, usually the chest or wrist. This process of taking blood vessels from one part of the body and connecting them in another is called grafting. The surgeon will then join the graft to the aorta, the heart's most important blood vessel, at one end, and the coronary artery at the other end, past the narrowed area. This means that blood is carried around the narrowed section, and a healthy supply of oxygen and nutrients is now supplied to the affected muscle cells. CABG can improve blood flow to your heart, relieve chest pain, and may even help prevent a heart attack.